Pretty soon. So. What's that?
She said she sent you the EAP stuff. I mean, did you have a chance to look at it?
I haven't looked at it yet.
Okay, so I was like, I mean, if it's not, if we qualify, like, I would not for her. That's here. So if we can qualify to be a provider, I don't see an issue. We just report some extra.
Yeah.
And that could be something like Rachel work with you.
Yeah.
Let's see.
Yep. All right, so we'll go ahead and get started here with our second lecture in our community series. What is your core? So today we're going to talk about what your core is made of. It's a very hot button topic in terms of, you got to strengthen your core, you got to get a stronger core. All the information you get out there, some of it's great, some of it not so much. But we're going to look at, what actually is your core and how do we develop our core to begin with, and some things that you can start doing now just to start working on some core strength and stability. And hopefully this can help with some low back pain and different things like that. So when I asked ChatGPT, make me a picture or draw me a picture of a strong core, clearly they went into my photo archives and dug this old picture out of me. So it's very common. Like this guy has a strong core. You can tell because he's got rip muscles, all this stuff. That's not always true. I'm sure this guy probably does have a strong core, but it doesn't necessarily mean that he has an efficient core in terms of what we're talking about when we talk about core strength. So yeah, you can have muscles, you can have bigger muscles, but does that equate to a stronger core? Not necessarily. So when we actually look at what your core is, some of the muscles of the core, we're not going to go through all these in a lot of detail, are the multifidus, the psoas, quadratus lumborum, transverse abdominis, internal and external obliques, our pelvic floor, our diaphragm, and our glottis. So the last three are three of the core muscles that we don't really hear too much about. So I'm hoping to kind of shed some light on some of those type of things today and see if there's anything there that might kind of get your guys' attention. So when we first look at the multifidus, this is a picture of the multifidus. This is the back of your spine here. This is a view from the back of the person. The multifidus goes from segment to segment and provides that intersegmental stability. So it's got that segmental control that we really need. In terms of movement, it has a small movement contribution in terms of extension, rotation, and side bending. But the main thing here is the segmental control. It helps with our capsules and our joints in the spine, so it keeps them from getting impinged or pinched upon each other. And then it helps with some motor control. So when we talk about, our core firing, these muscles should fire briefly before we do any type of movement. And so we'll get into that here in just a little bit. But the multifidus is one of the main ones that we need to treat, especially people who have had chronic low back issues, who have had surgeries, including disectomies, fusions. A lot of the time, these muscles can be adhered down with scar tissue, or it can just have some inhibition in the muscle. So we want to make sure that we're really working on some friction or doing some sort of strengthening or dry needling or anything like that can help revitalize these multifidus to help restore some of that segmental control between each individual session and individual section of the lumbar spine. Let's see, next one we look at here is the psoas. So the psoas muscle comes along the front side of the spine, comes off the front side of the spine and comes down and connects to the hip. Now, this one's a powerful hip flexor muscle and is often accused of being really tight. So everyone's like, oh, you need to release your psoas, you need to stretch your psoas. Sometimes when you have chronic tightness in a muscle, it doesn't necessarily need to be stretched or released. Sometimes it actually needs to be strengthened. So the psoas connects from the transverse process or the ends of each individual vertebrae, starting all the way up at L1 and coming down and connecting into the hip. So when we look at posture in this right up here on the slide, the psoas plays a huge role in maintaining proper posture and helps stabilize the pelvis. And it also helps stabilize the lumbar spine during activities such as sitting, standing, and walking. So weakness in the hip flexors, sometimes if they have some weakness, our body's going to say, okay, well, how do we make more stability? How can we get the lumbar spine to stabilize? I know, we're going to make the psoas super, super tight so it can't move. And so there is some benefit to releasing a tight psoas, but you also need to say, like, hey, if we're always coming back and the psoas is always tight, or I have to do a psoas release every day, maybe we need to incorporate some strengthening along with that lengthening to try to give it more of a chance to help stabilize the spine and make it more efficient. Next muscle we're going to look at is the quadratus lumborum. So again, this is looking from the back side, looking along the lateral side or the side of the spine here. You can see the quadratus lumborum is highlighted here to the left of the spine. It plays a huge role in stabilizing the lumbar spine. Again, when we look at how that muscle runs along with the psoas is going to be more on the front side of the spine. The quadratus lumborum, or QL, is going to be on the back side of the spine. Those two help stabilize the segments as they run from the rib cage down to the pelvis. In this particular case, the QL also has a role in helping with our breathing or expiration, which we're going to talk about when we get into some of the diaphragm stuff and some other postural things. So the pressurization or the stabilization with pressure in our lungs and in our body, the QL can actually help with some of the expiration and the breathing aspect to help with some of that stability piece. Another big hot topic muscle is the TA, or the transverse abdominis. This muscle wraps around almost like a corset around our body and helps provide some stability. Can help with different lifting and twisting movements, but again, coming back to that intra-abdominal pressure. So the TA can help increase pressure within the abdominal area, which again, for forced breathing out or expiration, urination, defecation, those sort of things. So it does help to provide some stability and some intra-abdominal pressure, which again is going to be a key in what we're going to come back to in terms of a healthy core. Our internal obliques run from, and like our fibers are oriented in this direction. So that runs from our pelvis up to our rib cage. Again, these help with some respiratory assistance. So the internal obliques help with that expiration, help get air out of our lungs. They help maintain intra-abdominal pressure and help provide some pelvic and spinal stability. And importantly, they're this huge fascial connection between where our pelvis comes up to our rib cage and then continues on to our shoulders. So we get this cross stability pattern coming in with those internal obliques that can really help with some rotatory movements and some just stability overall. It also helps provide our pelvis to go into a posterior tilt, which if you have a kind of with this position, you're going to have some weakness in the internal obliques. So we need to get those to strengthen to get more in that posterior pelvic tilt. The external obliques, again, these are going to help with some flexion, rotation, and side bend. They are more, instead of the internal obliques that are oriented in this fashion, the external obliques are more oriented in this direction. So you think about the sling that comes around to the shoulder, engages with the external obliques as it comes down through here, and then blends with the opposite side of internal obliques. So again, helping with breathing, helping maintain that key intra-abdominal pressure that we're going to talk about here in a few more slides. Now we're going to get into some other muscles and muscle groups that maybe aren't as talked about as much as some of the previous ones. So our pelvic floor. So Heather can actually talk a lot more about the pelvic floor than I can, but the pelvic floor is basically the basement of our core. So without the basement, we can't have any, if we have a weak basement, we can't build up that pressure, that intra-abdominal pressure we've been talking about. So if you have weakness in the pelvic floor, it's hard for the rest of the muscles to engage and to truly provide some great stability because of that weak link in the chain. Not only does it help with some core stability, but also with continence, sexual function, pelvic stability, again, in breathing and posture. So every time we breathe, that diaphragm should come down and it should actually build up pressure in the pelvic floor. When we go to expire, then that pelvic floor rebounds and we get this kind of ebb and flow with the diaphragm and the pelvic floor with inspiration and expiration. Speaking of diaphragm, you can see in this picture here, top picture on the right, where there's this key relationship between the diaphragm and the pelvic floor, where you get this interplay of air pressure that comes up and down with each breath. So again, with the diaphragm, it's our way that we're efficiently breathing in and out. It helps maintain some of our abdominal pressure, maintain some esophageal pressure, and it actually helps with some other movements in terms of lymphatics. But for our sake of our discussion today, we're primarily going to talk about that air pressure or the pressure system that the diaphragm helps create between our thoracic cage or our upper part here, and then our intra-abdominal or our lower abdominal and lumbar area down here. And last but not least, I'm not going to spend too much time on this one. I feel like this could be an entire other topic, but looking at the glottis and how the glottis actually helps stabilize our neck and is part of our core. So if we think about where the diaphragm comes, we have the esophagus that comes up, the trachea comes here. The glottis is kind of like that cap on top of those. And so if we don't have an efficient closing of our glottis, which if you're tongue doesn't rest on the roof of your mouth, if you often are mouth breathing, a lot of people who have CPAP machines or sleep apnea, a lot of the times they have poor glottis function. The airway closure is a key thing that we need in order to create that intra-abdominal pressure. And without that adequate closing of the glottis, we can't actually get great stability into our core. It's most evident when we think of the core as a pressure system or a can. So again, in this can, the muscles we've talked about, we have our pelvic floor, which is the basement of our can. We have our abdominal cavity that's wrapped around with the transverse abdominis, our internal and external obliques. We have the stem down the middle of that abdominal cavity, including our multifidus, our QL, our psoas, comes up to the diaphragm, or that middle part of the can, into our thoracic cavity, where we get a lot of our air pressure into our lungs, and again, up to our vocal cord. So at any point, if the can is closed, most people, you're able to stand on the can and it doesn't crush. The second that you pop the top, you can squeeze in from the side, you can step down from the top, and you can easily crush that can. So any sort of weakness or any sort of failure in any of these muscles can lead to some weakness in your core. So when we think about core, again, when we put in that for Chat GPT, you think of, oh, I need to have, abdominals. I need to, have this six pack. I need to be able to be really strong. That doesn't necessarily mean you have an efficient core. In order to have an efficient core, you have to have this pressure system that can be stabilized from the vocal cord all the way down to the pelvic floor, and really help us provide that intra-abdominal pressure that gives our spine some rigidity and gives us a chance to have some stability at our core, so we can move our arms, or we can move our legs, we can pick things up, we can run, we can do all the things that we need to do because we have a stable base to move from. So we want a strong core, but what does that mean? I love this picture because, as you can imagine, if you're shooting a cannon off a canoe, that cannon is not gonna, the cannonball is not gonna go very far because there's no stability of that canoe. The cannon's easily gonna overpower things. So it would be like if I tried to pick up if someone dropped a 500-pound weight on my arm and I tried to catch it, there's no way that I can stabilize that and be able to lift that 500 pounds. So we have to have what we call proximal stability or core stability for distal mobility, or the ability for our arms and for our legs to move and to be able to move things. So if we have weakness in that core, we're trying to fire the cannon from a canoe, we're going to lose some power. We're not going to have the strength and stability of what we would have if we did have a stable base to pull from. So what is a strong core? We've kind of alluded to that a little bit. An efficient core has three main things. It has proper initiation, it has strength, and it has endurance. So what do I mean by some of that? So initiation, so how well, if I come to push on you, how well does your core fire right away? Does it engage right away as soon as you get pushed? Are you stable? Or do you get kind of pushed back? Our core should work as a feed-forward mechanism. So Paul Hodges, who is a well-known physical therapy health research researcher, did a ton of research on the multifidus and a ton of research on our core, and determined that it should be a feed-forward mechanism for our central nervous system. So it promotes proximal stability in anticipation for anything that we're going to do. So if I'm going to lift my arm up to change a light bulb, my core should fire on its own without me volitionally holding, in order for me to be able to do that. In order for me to move my arm and reach up overhead, I need to have that stability. I need to have that stability in my spine. I need to have that stability in my scapula for my shoulder to move on. There has to be some stability in order to allow for that distal mobility. So the core response of our tonic muscles, which is our stabilizing muscles of the trunk, should have a firing of those muscles briefly just before you start to move any extremity. Here's another article that talked about the feed-forward mechanism of people with low back pain and people with no back pain. So the control group, people without low back pain, had an activation of the external obliques, the lumbar multifidus, the erector spinae muscles, and in a feed-forward manner, meaning they fired just as you're about to move, just as I'm about to move my arm, my core muscles fire, versus the people who had mechanical, or MLBP is mechanical low back pain. They did not have the activation of the trunk muscles in a feed forward mechanism, but they might have a delayed response, or they might have no response at all. They may have an absent core engagement. So as you can imagine, if I'm going to pick up a 500-pound weight and I have no stability here, I'm putting myself at a lot of risk for injury. It's not a guarantee that you're going to get injured. We have some other things that help provide stability, such as ligaments, discs. Our neurovascular system does on a slight level, but you are at a higher risk if you're not getting those core muscles to fire initially before you start to do some of the movements. The other one we look at is endurance. So this is an easy test that you can try to do, called the Bunky test. It's a great way to look at endurance in different angles or different fascial and stabilizing lines. So in the Bunky test, they took athletes and they said that each position, so the posterior power line with the leg straight, the posterior stabilizing line with the knee bent, the anterior power line, the lateral, and the medial stabilizing lines, as you can see in the picture, each athlete should be able to hold these for at least 40-second count. If you are less than 20 seconds or you have pain during any of these positions, it indicates a reduced muscle performance, which then can lead to an increased chance, not a guarantee, but an increased chance of injury. So the Bunky test is a great way to, one, assess to see, hey, am I strong in all these different stabilizing lines, or do I need to work on them? And then you can actually turn the assessment into your treatment. So one way to get better at planking or the anterior power line is to work on that anterior power line. So if you decide that you want to do this, in the research study to make it, to control it for norms, they basically said that the humerus, or the length from my elbow to my shoulder, is the height of the stool that they use. So you want to find a stool that's about that height, and you can try these different ones as long as you're not having a lot of pain during all this stuff. And again, you want to shoot for 40 seconds. But if you're having pain, if you're unable to do it for longer than 20 seconds, there may be an issue here that we need to address. And then one thing that we didn't talk about was the strength piece of it. But again, that's a little bit more forward. So we can test the stability. So I can come and push you. And if you are able to initiate, we have good initiation. And then we can grade that on the PT scale that we use on a 1 to 5 or a 0 to 5 scale of how much strength you have. So initiation, strength, and endurance is what we want out of our core. Some common myths about core. Again, utilizing ChatGPT, what are some common myths that you can hear? So a weak core muscle causes low back pain. So obviously, if I strengthen my core, my back pain is going to go away. Another one is you always want to brace your core tight during movements to protect your spine. The third myth is core stability comes from isolating specific muscle groups with specific exercises. So when we look at the first myth, weak core muscles cause low back pain. So obviously strengthening core will fix your low back pain. This isn't always true. Back pain is typically multifactorial, meaning there's multiple things that go into that, whether that is strength, that can be a component of it. Is it a movement piece? Is there stress? Is there certain lifting mechanics, certain sleeping mechanics that are causing the symptoms? Are there issues away from the back? Is the pelvis or the hip tight and you go to rotate and you have no mobility in your hip, and so your lumbar spine has to move a lot more? There's a lot of things that come into play with that. So yes, I think core stability and core strengthening is a vital component for low back rehabilitation, but simply strengthening your core muscles doesn't always take away your low back pain. The second myth is you should always brace your core tight during movements to protect your spine. Over bracing is very counterproductive. Again, when we look at our can analogy, we need to be able to breathe in and out of our diaphragm. So everyone who's watching, I want you to try an exercise. We're going to hold your core tight. So everyone brace your abdominals, really bear down so that you're able to really create that six-pack, that you're looking good on the beach. And I want you to try to take a deep breath into your belly, into your diaphragm. You can't do it. There's no chance, because you're holding this pattern down to where now we've started to create this pattern where our our core, our internal obliques, our external obliques, our rectus abdominis are holding so tight that now we can't efficiently breathe in and out of our diaphragm. We're not getting that ebb and flow with the diaphragm to the pelvis. We're not able to efficiently move lymphatics through our system because the diaphragm helps pump with that. So there's a lot of things that come into cause when we look at bracing our core. The other one not listed on here that I've seen a lot is that when some advice that I've seen people get is, when you're walking, you want to brace. And so then you look like you're, trying to find the bathroom and you can't find one. So you want to make sure that you're not developing these holding patterns because you're trying to help protect your spine. Really, our spine should be able to move. We should have controlled mobility. So if you have pain with movement, you want to get that worked on, but we want to try to restore that movement. We don't want to tighten everything up so that we create these holding patterns for the sake of trying to reduce our pain. We need to restore that movement. We need to restore efficient movement. And a lot of that comes with motor control, with mobility, with stability. So you don't want to have that automatic, or you want to have that automatic engagement, not that holding pattern. And the third one is that core stability comes from isolating specific muscle groups, like the transverse abdominis, for example, with specific exercises. It's, I would say, next to impossible, if not completely impossible, to isolate one single muscle. Again, when we look back at the research that Hodges did, that there should be some automatic engagement of our core muscles that fire anytime I'm moving my shoulder. It should stabilize my spine. So when it comes to training core stability, we're not going to pick an exercise for your transverse abdominis. We're not going to pick an exercise for your multifidus. Those aren't, they can be targeted, they can be emphasized with the exercise, but they're not going to isolate those muscles. So when you're training, you want to train in a variety of different ways and a variety of different movements, everything from maybe you have to begin in more of a neutral spinal position, but eventually moving out of that neutral position because we live a lot of our life outside of a neutral position, and we should be able to go into and out of a neutral position without pain. So you want to start working maybe in a more controlled position, but then start to branch out and increase the amount of movement that you're getting. So that way you can get the full body coordination between your arm and opposite hip, and the ability to go into rolling, into crawling. All those things require full body coordination in order to fully work. So what are some signs of a weak core? And these aren't signs that you might typically think of. So inefficiency leads to inefficiency. So if I have an inefficient posture, we're going to take the guy on the far left of the screen. If we have an inefficient posture where they're standing in this position, it's going to be very hard to then pick up a weight without the weight doing this. Likewise, with the guy in the middle who's standing more military style, if he goes to pick something up, he's going to rely a lot on this extension and low back compression to stabilize when he's not really able to stabilize and engage in the front. So a clearer picture of this, when we look at the guy standing on the right-hand side with this, posture like this, if I take him and this, we're going to pretend this is his pelvis, and this is his thoracic spine. So if he's in this position and we go to push down from the top, you're going to get this sort of movement occurring, right? So anytime they start to load, they're going to have a hard time engaging a lot of those core muscles because they're already in this holding pattern. They're already in this shrunken position. There's inefficiency in the muscles in terms of the ability to fire, or some of them that are inhibited. And so they're going to have a really hard time engaging their core when they're doing day-to-day activities. So you may lay this person down on the table and he may be really strong if we tried to push or pull or do different strength training. But the second we got this guy up into weight bearing and he stands like this and we tell him, I want you to carry a 100-pound sandbag, he's going to start to develop some thoracic or some shoulder pain, maybe some low back pain, or even knee pain or neck pain because of the position. When we look at this military style posture, again, if we take our foam rolls and they're in military style, so they're standing nice and tall, and we go to load them down through here, they're going to get that extension in their low back And a lot of the time you'll see with these type of people, they'll have this crease right along their low back where every time they pick something up, they always hinge at that position. So you'll see this crease develop. That's a key indicator that, hey, they're going to have some core weakness, some core instability because they just cannot efficiently stack their blocks. If you're in an efficient position here and I come to push down, there's a significant improvement in how well my system can tolerate the load versus in this overly extended position or forward flex position. Again, this doesn't mean that they're guaranteed to have low back pain or that they're going to have an injury. You're just at a higher risk for some of these things and you have a harder time efficiently engaging your core. So when we look at movement patterns, we want to think of this stability and mobility model. You can see like in the blue, you want more stability here. So you want stability in the middle part of the neck, in the lumbar spine, in the scapula. We want more mobility in the upper cervical area, in the thoracic area, in the shoulder, in the hip. And that's going to be a great way to stay in terms of movement efficiency. So we want to work on hip mobility drills while we're doing some lumbar stabilization stuff, while we're doing some thoracic mobility, while we're engaging our scapula, working on some cervical stability, working on some upper cervical mobility, if we're trying to correct these postures. If I have someone that comes in who's in this position and all I'm working on is their back, I'm missing the thoracic spine, I'm missing the forward head position, I'm missing a lot of the scapular position, which is here. We have to have all of this working together in order to have an efficient lumbar spine and an efficient core engagement. So how can you improve your core? There's so many exercises out there. If you looked at ChatGPT, if you looked at YouTube, if you looked at anywhere, you can find 3 exercises that are guaranteed to take away your low back pain. There's not one specific exercise that can take away your low back pain. It's not out there. I wish I could create one because it would help my kids go to college significantly. But if you can help improve your core, improve your stability, that's all we're looking for. There's not one magic bullet. So when we look at how to improve your core, you want to improve your posture, improve your resting position. Reduce holding patterns. As it may sound contraindicated if you're like, oh, my core is really strong because it's tight. You're in a rigid structure now. You're not fluid to move. So if something happens that pushes you out of that movement, you may be at a higher risk for injury. So you want to reduce those holding patterns so you can efficiently move. You want to improve the strength and mobility model that we talked about just a slide ago. You want to increase your core endurance. A lot of the times it's not the first play of the game when an athlete gets hurt. It's towards the end of the game because their endurance starts to wane. So if you're strong in the beginning, but you have poor endurance, you're going to be at a risk for higher injury. You want to build functional patterns. So integrating the arm to the leg, integrating these rolling patterns, integrating our developmental sequence, which we're going to talk about here in a second, can help improve your core. You want proximal stability for distal mobility. So again, coming back to that strength model, we want a stable cervical spine. We want a stable lumbar spine. We want stable scapula. So that way we can build off of our stability and use our mobility of our shoulders, of our thoracic spine, of our hips to help do a lot of our movements. So when you're trying to build stability, sometimes you need to teach things, right? So if our body's not used to firing, so let's say you've had low back pain for a long period of time and you end up having a lumbar surgery. You need to sometimes start from the beginning. You need to start to build your ability to engage the muscles. So maybe that is a volitional contraction. So this is the learning sequence. You go from unconscious incompetence. So you're unaware of the skill and you lack the proficiency. You might not know that you have trouble doing this, or you might not be aware that your core is weak. That's a problem. There's conscious incompetence. You're aware that it's not working, but you're not yet a proficient at doing it. So rather than if I'm going to move right away, I'm going to move and my core doesn't engage right away, or it's weak, I need to volitionally start to contract that. And that's not a holding pattern. I'm not bracing, but I need to think about how well can I move? How well can I stabilize? I need to think about my posture. I need to think about things before I do them automatically. Then we go into conscious competence. You're able to do the skill, but only with effort. So again, now we're able to do these things. We're able to get them to fire. We're able to do this, but again, we got to continue to think about, is my core firing? Am I doing well? And then we have unconscious competence, where automatically you're go to pick up something and your core fires and you're off and running. These are the areas that we need to get to in order to have a strong core. This is what we need to really focus on, is building those repetitions, building that endurance, building that strength to where it becomes automatic. Just like tying your shoe. Now, if you're an adult and you tie your shoes all the time, you probably don't think about it. But when you're a kid and you were learning, it takes a long time. It takes a lot of thought. So if you think about exercise and core stability in that sense, when you have low back pain, it makes it not less frustrating, because you're still going to get frustrated if you're not getting things, but it puts it in perspective as to, hey, this might just take some time and some learning. So when we think about a baby, right? So we have a 2 and a 4-year-old. So we're fresh through some of these phases. And when we're first born, a baby just lays there, right? They might, they're breathing, they're laying there. So they're breathing, they're working on the diaphragm. That's one of the first things that we have to be able to do, is breathe, right? Then we start to move around. We start to look with our eyes, and then we start to maybe turn our head, and then we want to reach for things. And then we can turn onto our belly. We want to work on that prone on elbows, that prone position. So we're working on constantly looking up and holding and looking around as a baby. Then we develop our ability to roll. We can now get more mobility. We can go from our back to our stomach and then back to our back again. We can start to roll roll to get somewhere now. Our daughter would roll around that. Like we'd leave her in one spot and we'd come back and she was 20 feet in another direction. Then we can start to get strong enough to go into a quadruped position. Now we can push ourselves up. We can start to stabilize ourselves in a long plank position, holding our shoulders, holding our hips over, having core stability. Then we can start to add our movement. We can start to crawl. Then we can come up into sitting, into kneeling, squatting, vertical stance, pulling ourselves up, and then beginning to walk. So someone with low back pain, we may take them through some of this developmental sequence. So one of the assessments we can look at is how well you can roll. So everyone can do this at home. Lay on your back and see if you can roll to your left. See if you can roll to your left with just using your right arm. See if you can roll to your left just using your right leg. See if you can roll to the right using your full body, with your arm, with your leg. See if you can go from your stomach to your back using just your arm or just your leg. All these ways are a great way to kind of look at your movement pattern and say, hey, I'm having trouble doing this movement. I need to start working on that. So rolling is a great assessment to look at just your functional movement pattern. And then you can turn that into an exercise, right? So if I'm having trouble rolling from my back to my stomach using my right arm, I want to start working on how well can I reach up in this like oblique position to try to start the roll? How can I start to incorporate my head and my shoulder and my core? And then eventually you start to work on it enough to where now I can add some resistance. So now maybe I take a band and I work on this full rotation pattern. You can start to build up some repetition, some endurance, some prolonged holds. That's the other thing I haven't talked about was as a baby, you're in these phases for a long time. I'm working on, if I'm in the prone position as a baby and I'm working on holding my head up, you'll see them hold it up for a while, then their head comes down. And then you see them hold it up for a while, then it comes down. They're working on endurance of their cervical spine. So this is a huge thing. You want to work on endurance of things and just these holding patterns. You'll see them in a quadruped position where they just sit there and rock back and forth. Crawling is a great exercise for adults. Get your bear crawl. You can do a resisted crawl. You can do something where you're crawling backwards. Tall kneeling, starting to load yourself. Squatting, we're starting to load into the ankles. You're getting the hip mobility. If you ever watch a toddler squat, that is the most efficient squat you'll ever see. They can hang out there. Our son can hang out in his squat for hours and play, and I'm struggling. That's an issue. I have, maybe a foot and ankle issue, maybe a hip issue, but there's a lot of things you can see in how a person squats. So some of the better core exercises are looking at some of these developmental sequences. What are you having trouble doing? Are you able to lift your head up off your pillow and hold it there for a minute? If you can't, maybe you need to work on some cervical stability. So breaking down these neurodevelopmental sequences and developing some core strengthening exercises from there can really help kind of rewire the system. Our body learned how to fire its core on its own because of these developmental sequence. So you go back into the sequence, and it's an easy way to start getting some of that engagement back. With that, I feel like I've talked enough. Are there any questions at this time?
Greg, it's Mike. First
Hey,
of
Mike.
all, let me just say hello to you, and
Yeah.
really a great job. I think your delivery of all the scientific information was very well done.
Thank you.
Obviously, it shows that you put a lot of preparation into it, and you're able to deliver it in a meaningful way for people like us to listen and learn. Just as an FYI, I am still having the issues, if you don't mind me sharing. I know we've got
That's up to
one
you.
or two
If
other
you want to
people.
share, yeah, feel
Okay.
free to share.
Yeah, I've got the numbness continuing, and I have been receiving increased dosage of vitamin B12, which I understand that can, if there's a significant shortfall, that can contribute to, I'm going to say, neuropathy. I don't know if it's nerve issues or what. To this point, it's not happened. It's not really made any progress as yet. But I was out at my place today with one of the head massage therapists. He wants to help me and claims that he's one of 3 people out of 60 in the world that basically can fix the skeletal things. He's heard me talk about my issue for quite a while. And I think what I'd like to do is probably have you meet him, because I want him to listen to your scientific doctor brain and see if that scares him off or further encourages him. Are you open to having some kind of a meeting with him at some point?
Oh, sure. Yeah, we can set something up like that.
Okay, good. And sorry for the other person on the call that I interrupted here, but again, I just wanted to compliment you on what I think was a great job on the delivery.
Well, I appreciate it. Yeah. Yeah. Let's reach out to me after. We'll chat about some of that stuff, and then kind of see what else is still going on with you, Mike, and kind of talk about some of the other stuff you've been doing, because I know you've been dealing with that for a while and kicking the idea of surgeries and stuff like that. So I'd love to catch up with you on that.
Yeah, I will definitely give you a call and catch up. And yeah, and also I need to get back in for scheduling on a frequent basis, because I don't know that we ever saw any real improvement in the numbness as a result of that. But for sure, like you and I talked about, and you just spent a lot of time talking about, strengthening the core.
Yeah.
And I need to be doing that. So yeah, I'll be in contact with you.
Yeah, I'm interested to see if you ever got the one blood test done, or the cycling thing. Did you ever find a place to do that?
The more I looked into that, I did not. No, I did not feel that it was for whatever reason, I decided not to do it, and I can't even recall all of the detail. Sorry.
No worries. No worries. We actually we have a Peloton up here now, so maybe we can just do a quick thing with you and see if that changes anything. I'm just curious.
Okay. Yeah, and I have had Dr. Singh do the nerve test thing again.
Yeah.
And he says nerves are good. He's strongly encouraging me to avoid any additional surgery.
Good.
So, okay, I'll shut up. Maybe the other person has something to say.
Well, good hearing from you, Mike. I appreciate you jumping on and supporting us.
Likewise, you bet. Okay, so this is a conclusion of the Zoom.
Yep. Yeah. This is unless Donna, do you have any questions or?
Well, I do. And actually, Mike's story sounds a little bit like mine, to be honest, because I've got low back and haven't done surgery and am trying to stay away from surgery, as Greg knows. I'm interested in the developmental sequences that you talked about.
Yeah.
And then the bunkie tests. So not sure if that's something that works into my issues that I have. I would think that developmental sequences would be a great test to do.
Yeah. Yeah, we can look at some of your rolling. I think there's going to be a couple of them that'll be interesting with you. I have a prediction with that. How was it after we did some of the neck stuff last time? Did that change anything with your morning symptoms?
No, not
No.
really. And
No.
I did start the gabapentin. I broke down, but it hasn't changed anything.
Gotcha.
Mhm.
Okay. Happy to, we can run through some of that stuff, and then I can talk you through the bunkie test, or we can do that. And then, we can look at that next time. I think you come in,
Next week, I think. End of next.
yeah. So
And
we'll,
then, go ahead. I'm sorry.
so we'll look at that stuff with you.
Okay. And then the Peloton that you're talking about,
Mhm.
what in cycling, is that just positioning and
No, that was more of a specific thing for Mike. I was just curious because there was some stuff that we saw that there's a test to do to look at like blood flow and things like that using a bike, and so that was just more specific to his diagnosis, nothing with positioning or anything like that.
okay. All right.
Yeah.
All right. Those were my couple of questions. If anything else comes up, then I'll text you too.
Yeah, text. But yeah, I appreciate you guys jumping on. I'm gonna post the presentation and and everything on YouTube, so you can watch that again. And then we are gonna do another one next month. I'm trying to do these monthly now. So April 17th at 4, we're gonna do one. So looking at maximizing sleep. So that'll be an interesting one for some in terms of trying to learn how to fall asleep better, stay asleep, and get the most out of our sleep in terms of what actually happens while we sleep and why it's important that we get sleep. So hopefully you guys can join next month, but I'll post all this stuff up. And in the meantime, you both have my cell phone, so feel free to shoot me a message if anything comes up.
Okay. Sounds great. Thanks, Greg.
Thanks, guys. Appreciate it.
Have a good night.
You too.